Today, we are tracking your tax dollars. Lawmakers are working to address fraud in several state-run public assistance programs.
Minnesota's new House Fraud and Oversight Committee putting leaders of the Department of Human Services in the hot seat just today. So we have team coverage. Ryan Raish following the very latest move from Governor Walz.
First, Eric Shalou was at the hearing, and he's joining us live at the Capitol right now. Eric?
Lee and Paul, we heard today here at the Capitol from the interim DHS commissioner who told lawmakers about some new efforts underway to try and stop fraud. We also got a glimpse into just how big these investigations are, about 1,000 into a variety of different programs, the commissioner told us. We also heard during the hearing today some Minnesotans that testified that they reached out to DHS telling them about problems and never got a call back and got any help. Called to testify before the House Fraud Prevention and State Agency Oversight Committee was Kane Pence.
And how many times did I call DHS? They didn't do a damn thing. Nothing until there was the news report.
A couple of weeks ago, we shared Pence's story when he alleged his state-paid care provider wasn't always helping him, and he was concerned with how much the state was being billed. Pence told the committee DHS called him after our story aired.
The next day, they happened to call me. I find that to be more than just a coincidence.
But there is no evidence.
Representative Isaac Schultz pressed the Department of Human Services on responses to complaints.
How long does it take for a Minnesotan to get a response from your agency when they have credible fraud complaints?
I don't know the exact timeline, right? We have to triage, we have to assess risk, we have to prioritize.
DHS revealed there are 1,000 open investigations looking into several taxpayer-funded care programs. For example, DHS says they've suspended 115 providers' payments in the Housing Stabilization Services program and turned them over to law enforcement.
Have you, at this point, been able to come up with any kind of a rough estimate of the dollar value of the fraud, just what you've caught so far?
For the 115 providers that we've suspended payments to, those providers in total have billed us about $100 million.
DHS Inspector General James Clark says law enforcement will determine the total amount of possible fraud out of that $100 million.
We had a past practice of waiting to stop payments until investigations had concluded.
Acting DHS Commissioner Shireen Gandhi says that practice is over.
We flipped that and decided we were going to stop payments as soon as there was a credible allegation of fraud.
Commissioner, there's a lot of changes that is coming from DHS to try and stop fraud. Do you think the state waited too long to go after this issue?
In hindsight, you always look back and think that you wished you would have done more and gone faster. I think there are things we need to do differently.
And one of those areas the Inspector General brought up to lawmakers, saying he'd like to see the vetting process for potential health care providers that are in these different state programs have a deeper look into their backgrounds beyond the standard background check that they do at this point. So a lot could come out of the legislative session coming up this winter. But that's the latest here at the Capitol. I'm Eric Shalou, 5 Eyewitness News.